Up next, we have Eduardo and Leonor. Eduardo Huesca is a program coordinator and outreach worker with OCOW and has 15 years of experience working with Ontario temporary foreign agricultural workers and their employers on occupational health and safety issues. He's presented OHS education workshops to over 1,700 temporary foreign agricultural workers across Ontario in English and Spanish, and has worked to improve the accessibility of occupational health and safety information for these workers. Eduardo is focused on pesticide safety issues among temporary foreign agricultural workers and helped develop the Ontario Pesticide Education Program, OPEP's, first Spanish-speaking pesticide safety instructor team. Since 2017, Eduardo has been a member of the planning committee for the Midwest Stream Forum of Agricultural Worker Health, led by the U.S. National Center for Farm Worker Health. And Leonor Cedillo is a researcher and practitioner in occupational health and safety, specializing in the study of psychosocial factors at work. Her projects of research, applied research, and training on disadvantaged and vulnerable worker populations have been related to pesticide exposures among Indigenous and internal migrants working in the agriculture in Mexico, work organization and psychosocial factors among women workers in the assembly plants and export industry in northern Mexico, health and safety among temporary foreign workers in Canada, and most recently here at OCOW with our migrant farm workers in Ontario and the projects that we're working on. So thank you, Eduardo, and thank you, Leonor. I will turn it over to you guys for your presentation.
Thanks so much. So yes, I'm Eduardo Huesca, and I work for OCOW and was a coordinator for the project that myself and my colleague Leonor Cedillo will be presenting on today. So before we get started, we just wanted to note that the scope of this project ended up being quite broad. We tried to do a lot. And we previously presented findings from this project in about an hour and a half and still didn't end up covering everything. So we're going to do our best to provide a general overview of the project. But we do invite you to review our final project report that we maybe can put in the chat or share with you after the presentation, as there's a lot of important findings that that we accumulated through our engagement and interviews with Ontario migrant agricultural workers and additional stakeholders working with them. So before also getting started, I wanted to give just a really quick background for anybody who's not familiar with migrant agriculture workers in Canada or in Ontario. So we like to share this photo. This is one of the first groups of men arriving to work in Ontario under these temporary foreign agriculture worker programs. So these gentlemen were coming from Jamaica to Niagara region in Ontario. And so, since the 60s, men and women have been arriving under these programs to address severe labor shortages in Canadian agriculture with a strong presence in Ontario. And really have been largely key to sustaining the agricultural sectors in Ontario and various other provinces. So they, arrive under tied work permits. So that's a work permit only being able to work for one employer, generally speaking, and for up to 8 months or 2 years are their work permits. They usually are living in housing provided by their employer, often on the farm itself, and usually generally cannot access permanent residency in Canada. So some people have kind of discussed them as a captive labor force. Other researchers have noted that they experience structural disempowerment, and we're going to get into that a bit. But structural disempowerment to raise occupational health and safety concerns for fear, of losing their job and being deported or losing their opportunity to continue under these programs to come to Canada. During COVID-19, they were identified as an essential worker group or essential workers by the government. Unfortunately, there was several outbreaks on farms across Ontario where migrant workers were employed, and there was several deaths related to COVID of workers as well. So just a little bit of that context. So in terms of our project, the main goal was to create an inventory of mental health and psychosocial well-being supports and services available to Ontario migrant or international agricultural workers, and to distribute findings to these workers as soon as possible during the 2021 agricultural season. So this priority was identified by the project funder, the Ontario Ministry of Agriculture, Food and Rural Affairs, and the project itself can be conceptualized as a rapid response project in the context of the mental health needs of a vulnerable worker population during the COVID-19 pandemic. In addition to sharing findings of the project service and support scans with agricultural workers, we also sought to better understand key issues affecting their mental health and well-being. And therefore, we conducted a review of scientific literature and also conducted structured interviews with 26 Ontario migrant agricultural workers, as well as with additional stakeholders, including 20 agricultural worker community support groups, 7 employers hiring migrant agricultural workers, 2 Ontario employer associations, 7 community health centers servicing these workers, one Ontario mental health organization, 3 mental health initiatives specializing in work with migrant communities, and 3 Ontario legal clinics. So from the findings of all of our project activities, we ended up updating our inventory and the posters that we're going to discuss. And we also identified promising practices supporting the mental health of Ontario migrant agricultural workers, but we also identified important gaps and recommendations for intervention. So in terms of today's presentation, I will review our regional resource and service support scans and poster creation activity and some of the evaluation we conducted around these resources. And then my colleague, Leonor Cedillo, will present on our literature review and on some of our findings, some of our interview findings, after which we will present some of our recommendations, hopefully leading to some discussion then. To note, this project took place from May 2021 to March 2022. So in terms of theoretical framing, the project was developed under 2 conceptual frameworks: the social determinants of health, which demonstrates the ways social, economic, and political factors such as income, immigration status, education, work, housing, gender, race, and ethnicity, among others, influence physical and mental health outcomes, and occupational health and safety, which focuses on work environments and human activity within those environments. And both frameworks emphasize prevention through the design and implementation of policies, strategies, and interventions at the socioeconomic and workplace levels. So getting started reviewing our regional scan and resource poster creation activity. Again, this activity focused on identifying community supports and services available to Ontario migrant agricultural workers that are protective of their mental health and psychosocial well-being, that can prevent and address factors that can put their mental health at risk, as well as supports and services that can help individuals who may be facing mental health challenges. In total, we looked at 8 Ontario regions for our scans. These included Bradford, Brantford, Brant County, Durham Region, Haldimand, Norfolk, Hamilton, Carlisle, Linden, Niagara Region, Sarnia-Lambton, and Windsor-Essex. These regions were selected by looking at data available on the regions with the highest number of migrant agricultural workers in Ontario, and the regions with the fewer numbers that were selected were based on our project team's connection to workers or community groups in these regions to facilitate a bit of a faster process within our scan, kind of reflecting the fast project timeline that we were provided. The scans consisted of internet-based research and review of secondary data related to services and supports for Ontario migrant agricultural workers, as well as extensive engagement with known regional stakeholders and support service providers to clarify information on known supports and services and to identify information and referral to others not previously known. So following a snowball or chain referral sampling technique. In our project report, we describe this process in more detail as it was quite labor intensive with a lot of engagement with many community stakeholders. In the end, these scans culminated in identifying 89 organizations, services, and supports available to Ontario migrant agricultural workers, and this inventory was completed on June 18th, 2021. The supports and services information across the 8 regions were organized into 3 categories: community connection and support, which included organizations and community groups creating opportunities for workers to connect, socialize, build community, including faith-based community, which was identified as something important to these workers. Also events, recreational events and activities, but also included community groups actively providing essential resources to low-resourced workers, including food, toiletries, clothing, kitchen equipment, as well as COVID resources like masks, respirators, and hand sanitizers. It also included community groups actively helping workers connect to additional services, including healthcare services in their region, as well as helping workers navigate through government processes and procedures, many around COVID-19 policies and requirements, as well as helping workers navigate government reporting channels related to situations of concern. Category 2 was healthcare services. So this included information on health centers and clinics specializing in services and outreach to migrant agricultural workers, as well as other services identified to be more or less accessible to them. Pharmacies were also included that were identified as being able to guide workers, provide guidance to workers with staff speaking worker languages. Sexual health clinics that are actively providing outreach to these workers were also included, as was telehealth, the Ontario telehealth number as a resource that more isolated workers could use as well to connect to nurses for general health advice. The third category of information we organized was getting help for stress and worry, and this included services and supports more specifically focused on mental health, ranging from mental health promoting programs and services to those responding to mental health concerns, including counseling services, as well as urgent or crisis lines and services as well. So the information gathered was laid out into a poster template, leading to the creation of 8 regional resource posters that we then created in both English and Spanish, reflecting the 2 largest language groups among migrant agricultural workers in Ontario. And we also created both a digital and a print copy version. So here's a bit of an example of one of our version 1 posters, so you can get a sense of what these initially looked like and the various categories here. In terms of the distribution, I'm not going to go into this too much because we're probably don't have a lot of time, but we put a lot of effort into distributing both the links of the digital formats of the posters as well as we printed hard copies of the posters. The distribution was very challenged by COVID-19. Obviously, this was a time of a lot of lockdowns, a lot of isolation, so it was very difficult to get these posters in the hands of workers. And so a lot of our partners, though, did help us. One public health unit mentioned that they dropped off printed posters to all the worker housing as part of their housing inspections for their region. And other community health centers printed some and dropped some off. But definitely we experienced a lot of challenges. In September of 2021, as COVID-19 numbers improved a bit, there was some in-person community events that were organized in various regions. So our team was able to travel and do some direct distribution of the resources to workers. So our project really sought a lot of opportunities to receive feedback on the posters, both to have the opportunity to improve the posters within the project timeline, but also to continue building our understanding of resource creation and distribution strategies for this worker population. So in addition to various receiving direct email feedback when we distributed the posters, we also included poster feedback questions in our project interviews, which my colleague will get more into. But here I'm just focusing on some questions specific to those interviews that we asked around the posters. So in our final report, we go into this in more detail, but again, I'm just going to be providing a bit of a quick overview. So we asked the 26 workers we interviewed whether they found the information on the posters across the 3 categories useful to them. And generally, we found that workers identified that the information indeed was useful. And so just in terms of some of the themes that came out of the answers of migrant farm workers, even though, again, in our report, we have a bit more detail, the benefit of being informed about community supports and services in case the need arises was identified as a key part of the benefit of these posters. And in these responses, we saw that several mentioned specifically in case of injury or illness. So we are going to get into that a little bit more later on, but the theme of workers being concerned or worried or feeling at risk of injury or illness was something that came up repeatedly in the interviews. Another theme that came up was the benefit of being informed to increase independence in accessing services and supports. And here we saw responses that specifically mentioned the benefit of being informed as to not depend solely on their employer to access services. Another theme was generally the need for information due to a lack of knowledge and information not being shared with workers. So here we have a quick quote from a worker who said, this information is very helpful since when we get here, we don't know anything and the farm becomes our little world. Knowing about organizations is important to help us know and learn more in general. In reality, there is not much dissemination of these services or organizations among the farm workers. I think that the organizations that are offering these supports and services should work more in that area. We also asked workers about other topics that they were interested in receiving information on. So here on the left, we see topics like information about rights in Canada, accessing permanent residency, information and benefits as some that received numerous or were identified by numerous workers. We also asked workers about their preferred format for receiving information. And here you can see that video and audio messages ranked high as well and then also posters. We also asked workers for feedback on resource distribution strategies to reach them and their coworkers. And we saw a lot of responses identifying sending information resources through the WhatsApp messaging application. So as part of the responses that we received in the interviews, they dug a little bit deeper to note that it was important to ensure that resources were compatible with the WhatsApp application. And a lot of workers noted that sometimes they were receiving resources that they could not open through WhatsApp. And then also the issue of internet connectivity was also flagged with some workers noting that they don't have access to internet, which also makes receiving information even through WhatsApp, which is their preferred route, difficult as well. We also sought feedback from around the posters from the additional stakeholders that I mentioned that we interviewed. So again, I'm not going to really get too much into this, but generally speaking, some of the key themes were that the posters included information that was new to many of these stakeholders. So even among stakeholders that were providing primary healthcare services, these communities, they were finding information on their regional poster that they were actually not aware of. So that kind of connects to them identifying these posters as a useful tool for themselves, as a referral tool to refer workers to other services in their region. And generally speaking, we received also a lot of feedback around the information being correct and thorough. And so, sorry, I just skipped ahead. So that I'm going to leave it there, and really we're going to kind of talk about how after this resource development and we received feedback, we really wanted to understand a bit more beyond a resource development activity. So my colleague is going to speak to that in terms of our literature review and our interviews. So I'll pass it over to you, Leonor.
Thank you, Eduardo. Good morning, everyone. Addressing the questions of why and how is the mental health of these workers at risk, I will start with what is already known about agricultural migrant workers worldwide, followed by the way of what we did in this project, specifically the literature review and the interviews with workers. It is already known that migrant workers around the world experience similar psychosocial pressures, causing emotional concerns. Among these pressures are their distance from their family, friends, customs, and references, the lack of familiarity, acceptance by the society where they arrived, and the lack or insufficient knowledge about the work regulations and practices in the receiving country. Also, precarious employment relationships are common among these populations that are linked implicitly or explicitly to work protection exceptions in terms of hours of work, wages, working conditions, occupational health and safety, workers' compensation systems, etc. Then agriculture is recognized to be one of the most dangerous sectors for workers' health, along with construction and mining. And in Canada, several studies have been highlighted poor working conditions, injuries, and diseases, musculoskeletal and toxicological problems in this population. So we decided to search for additional information through the most recent scientific literature and first-hand interviews to stakeholders. Next, we conducted a literature review based on a set of keywords proposed by the multidisciplinary team for better understanding the pressures, the needs, and the resources for international agricultural workers' mental health in Canada and the US. This was considered that there would be more literature production in the US and some similarities might apply. We searched 3 databases and reviewed in full 160 papers. Next, reviewed papers reflect the inclusion criteria that privilege Canada and the US and countries of workers' origin, while main topics grouped by social determinants of health. In regards to a study's design, quantitative cross-sectional studies are predominant in our sample, followed by qualitative and literature reviews. 6 studies focused on validation of psychometric instruments. Next, most of the validation studies were related to evaluation of individual mental health, while only one collects information from the psychosocial environment. Literature reviews could be a good indicator of the level of importance or advance that a specific topic have gotten. The highlighted studies have been a starting point for understanding the health determinants of temporary foreign workers in Canada and the mental health of farming populations worldwide. The first one included 10 papers, most of them related to workers in the agricultural sector in Ontario, their health and mental health challenges linked to their precarious migration status. The second one included a meta-analysis of those studies using the same instrument, the CESD, which results suggested higher levels of depression among migrant farm workers compared with non-migrant. In the report of this project, you can find a list of psychometric tools reported in the reviewed papers, classified by objective and focus of coverage. This slide shows those for addressing workplace stressors. Other relevant work environment hazards influencing the mental health of migrant workers in agriculture reported in the studies relate to the safety climate and practices, supervisor support, demands, hours of work, and control over work. From the psychosocial work environment perspective, that looks to address the hazards in order to direct changes, helping to prevent or mitigate negative mental health outcomes and promote actions that could enhance positive mental health results. What the findings of this review showed was very limited. Other findings are presented in the full report that is available in the link, including a list of instruments reported in the studies and the classification we did. We conducted interviews with multiple stakeholders, included workers, community groups, employers, and I'm not going to say all of them because Edward already gave us that information. And methodologically, the project team members first established the purpose of the interviews and then developed a set of questions in concordance, as well as an interviewer guide, a reporting form. In this presentation, I will only focus on workers' interviews. The goal of gathering information from these workers was to learn about their main concerns while they are working in Ontario, the types of information or supports that they would like to receive, and their opinion about the accessibility and usefulness of the project's mental health resource posters, which Eduardo already referred and is going to continue at the end as well. Selection criteria for the interviewees was that respondents had to be employed on a temporary work permit and have been employed in Ontario agriculture during one or both of the 2020 and 2021 seasons. Workers were recruited through community group contacts who invited workers in the networks to be interviewed. Once details were confirmed, these groups provided the project team with the contact information of the workers, and project team members who share a similar cultural background to the participating worker conducted the interview. These were conducted in English or Spanish. 26 international agricultural workers were interviewed for this project. 11 were male workers from the Caribbean countries, and 15 were Latin workers from Mexico and Guatemala, 14 male and 1 female. 24 of these workers came through the Seasonal Agricultural Worker Program, and 2 came through the agricultural stream of the Temporary Foreign Worker Program. 20 of them worked in Canada during 2020 and 2021. 5 only worked in 2021 and 1 only in 2020. slide shows the type of agricultural work based on the most recent season they have worked at the time of the interview. During interviews, workers were asked about their everyday concerns and invited to talk about them. The reporting form included three main aspects of concern: those related to their work environment, for example, hazard exposures, work organization, interpersonal relations, among others; concerns about their employment, and concerns about their health. This slide shows the frequency of concerns at work. Among workers' responses, there was an emphasis on the hours and amount of work, safety hazards, and the risks of injuries. On the right, you can read one of their experiences. Experiences about mistreatment from supervisors were referred, as well as disciplinary practices. The employment relation of these workers is highly precarious, imposing high level of uncertainty and lack of control. Even workers who have been part of this program for years, they are unsure every year about if they will be called again. The situation puts an extra stress load on them. It was mentioned that they would like to know if there is a way for them to become residents. During interviews, workers also reported various concerns about their physical health related to their work. Of those interviewed, 16 workers reported concerns over becoming ill. Many workers reported concerns about becoming injured, while 11 expressed concerns about becoming disabled. Lastly, these workers live where they work, in the premises of their employer, in substandard houses that affect their quality of rest, their relationships with coworkers, and deprive them for any possibility of privacy and autonomy. Various other aspects of these workers' life when they are in Canada are presented and discussed in the full report. For this presentation, we focused on their work. The number of interviews is modest, and many of the problems referred by workers coincide with previous studies. Selection of workers is biased because the interviewees are those workers who are already linked to a network, in contrast with hundreds of workers who are more isolated and less informed. There is a modest contribution of the workers' interviews in exploring how the day-to-day work at the farm is. Social and safety hazards are particularly emphasized by the interviewees. These data are not useful for generalizing, and as is noted by some of the interviewees, there are differences among employers based on the experiences they have had along the years of work in Canada. While more research is needed for orienting policy decisions that improve the working and living conditions of this population, many actions can be taken for addressing the problem that are already documented. From the occupational health and safety perspective, there are unsolved questions that require information from the government. In other sectors, there are data available, and it is possible to evaluate indicators such as days of work, to health reasons, and turnover. However, turnover would be expressed differently in this sector, particularly among farms that employ international workers. For example, what is the renovation rate? How many workers stop coming because they are discouraged by the conditions or because they became ill? The healthy worker effect should be very important in this population. If we compare all the paths that these workers need to go through just for arriving to their work, there is also a need for research and intervention at the workplace level. I leave Eduardo now for abounding in more recommendations from the report. Thank you.
So much, Leonor. So I just kind of, and we're going to wrap up very quickly because I know that we're reaching the end of the time. But so in terms of a lot that we learned from the interviews that Leonor described, as well as the interviews with the other stakeholders, we did have time to update our resource posters, again, focusing at least at this resource level. So some of the additions were that, responding to the focus on workplace health and safety, we created a category and included information around the Ministry of Labor's contact number, WSIB information connecting to them, as well as our own OCAL information, as well as WSPS, the leading HSA focused on agriculture in Ontario. We also included some information under a new category called reporting situations of abuse or emergency that included a federal line open to workers to call if they experience situations of abuse as well. And then we created another category. We also focused on leveraging the Legal Aid Ontario number, and we didn't really touch on this, but a lot of stakeholders identified just the role that legal aid clinics can really play in supporting workers accessing and really mobilizing the rights that they do have on paper, but actually providing them resources to be able to act on them. I'm not going to get into this too much, but this is kind of in crux in terms of the limitations of focusing on resources. And here above, you can see various limitations, but I just really wanted to focus on the idea that, although it's important to focus attention on the availability of supports and services, and looking at supporting workers connecting to those, it's really important not to divorce this from continued recognition, understanding, and work to address the various structural factors that cause harm to individuals and communities. And in the context of these workers, it's essential to understand the ways poverty, immigration status, work and housing conditions, racism, and discrimination are all intersecting determinants of ill health and harm affecting them. And responses to these social determinants need to be incorporated into policies and practices if we are really truly attempting to improve primary mental, psychosocial, public, and occupational health outcomes for these communities. I'm going to stop there. We had a whole series of recommendations, both at practical levels, but more structural levels. But I think it's, we're not going to really get through them in any substantial way. So I think here maybe we'll end. And if there's any questions or discussions, and we'll share the report, and you can just jump to in the report to the end of the recommendations to touch on that. And I think Leonor's summary really touched on such key issues. So yeah, I'll end it there then. Thank you so much.
Thank you very much, Eduardo and Leonor. A lot of, I think, eye-opening information in here for some of our participants. It's important information to really to get out there, and more importantly to try to help with the recommendations and getting to the workers. So thank you very much, both of you. We do actually have a couple of questions, so I will take a look here. From Deb, in regards to the supports, Eduardo or Leonor, does the community supports include recreational opportunities, resources for fun activities?
Yes, definitely. We found a lot of those, and that was definitely a really important part. Unfortunately, a lot of those were canceled during COVID, and that's what we heard from a lot of community groups, is that a lot of the mental health protective and kind of supportive events and all of that were actually lost to workers during the COVID-19 due to isolation. But that was definitely every year. There's soccer tournaments, there's festivals. And so this year our team has, because of I guess lessening restrictions, there's a lot of outdoor events being organized this season. So our team is ready to attend those and spread these new posters, deliver these new posters to workers and other resources too. But yeah, definitely recreation events for leisure are key supports for these workers for sure.
Thank you. Excellent. Another question we had is from Laura. Is there an ability to provide this information as a welcome package when the agricultural workers arrive? I mean, it's such important information.
Yeah, so some of that is going on, and that's been a really big challenge, and I think shortfall from both levels of government, both federal and provincial. Again, these workers have been coming for so long, and just recently there's been initiative to, at the airport, provide arriving workers with resource packages. And it's funny because, this is a very organized and coordinated labor force. So the government knows where these workers are arriving to. They have to file, they have to get the visas, they have to, so the lack of kind of paying attention to getting that information as a welcome package is frustrating. But yes, that's starting to be happening. It's still not as coordinated. So the federal government has provided some resource packages at the airport for arriving workers, but that's only for seasonal culture workers. And there was a recent announcement of the increase in temporary foreign workers across other sectors where we don't know exactly how they're arriving. So that's going to be a bit more tricky because it's less coordinated. And that's just a decision that Canada has taken to open up less organized channels for people under temporary foreign workers to arrive. But yeah, we're working with the province to try to get then provincial health and safety information into those federal resource packages. But that's definitely a great idea. And yeah, it's frustrating that it's been so late of a thought in terms of the government leveraging that.
Leveraging it, yeah. Excellent, thank you. A couple of thank yous, very informative presentations. Deb's got a question. I'm not sure it's one. Well, I'll ask. And how is abusive behavior by superiors being addressed? Was this something that you, as part of your recommendations, any recommendations around any of that?
Like on,
Well,
I guess. Oh yeah.
I think that the problem is that these workers in general are fearful to talk to the authorities and ask for an inspection or something. Mm-hmm. So they are fearful of doing starting a complaint. So that is a problem that couldn't be avoided. And the other is that, well, they are not organized. They do not have a union or any other organization. So they are really, well, we know about this type of abuses through the studies or the direct interviews, but nothing else.
Okay.
And I think that, in some of the different presentations around, sensitization training at the workplace of workplace, respect, anti-harassment, that could definitely, go a long way in some of these workplaces in terms of, adding to the workplace culture in agriculture. And it's not to paint, and like Leonor pointed, farms and employers and supervisors, it's such a diverse range of interests. We work every year with a lot of employers that, yeah, they follow, regulations. They try to do their best in terms of communicating health and safety and hearing back from workers about their concerns, but that's definitely not the case across the sector. And so I think, looking at workplace policies that support, what we look at as respect and just even the supervisor role to be open to hear about concerns versus reprimand and kind of on the other way. So I think with workplace mental health and even the factors that, that OCAL has talked about, we can really pull those into conversations at the workplace level about workplace dynamics, co-worker and management.
Excellent. Thank you, Eduardo. And I think you've kind of answered this question coming from Kelly. So what can be done to nudge the employers to change their practices? And part of those recommendations that you guys have are to try to help with that. And you've answered some, but were there anything else you wanted to comment along that lines?
Well, I think that there is an opportunity at this point because there has been done much work than before with employers, with farmers in general on mental health. And I think that that could be, that could open a path for informing and putting the topic in the table. So that not only the farmers' mental health, but also the employees' mental health. Mm-hmm. And well, the thing is that we really do not have information in demographic data about these workers and where they go, where they are located, just the general information that we could have. And we know that most of them go to the very big farms that might be more difficult to go to, or who knows. Well, but I think that we should keep trying.
Mm-hmm. Yes, excellent. Yeah, thank you. Laura is just saying, wow, this is a great step in the right direction. Sounds like there's more work to do, which is where, again, the recommendations are coming and trying to get that information out there. and great presentation, incredibly informative and fascinating. Brings up a lot of concerns for the workers, which I think, as I was, saying, I think many people don't realize just how hard this work is for the workers coming over. So this is great information. Thank you very much for presenting today, guys. Appreciate it. I see, Kelly, you've popped up on the screen. Wasn't sure if you had a question or no.
Sorry, I was just going to say that at TMU we have a social innovation zone, and one of the products of the social innovation zone is Alula. And Alula is a technology-based app that initially started off with allowing workers in international locations to report on the working conditions, and it came from the perspective of the shopper wanting to ensure that the garments, typically that's how it started, were produced with respect, in respectful working conditions. Pardon my language, it's a little bit academic. Anyways, and so they expanded, and so what it does is it allows in an anonymous format for workers to report directly on the working conditions and whether or not they're infringing on human rights. And so this is relevant in other parts of the world. And then I was mildly disheartened, but I guess a healthy dose of reality that the same thing happens here with my tomatoes and cucumbers and everything that I get. And whether or not a local version of that, works with technology and is an anonymous reporting system, just allows and kind of diverts away from employees having to report. You can't have unlimited labor board inspections, but it feels as though my approach is sort of a carrot and stick. So this might be a stick of, if you have too many flagged issues regarding the working conditions, then that's not so good. And then sort of offering carrots to the employers of, wouldn't you want to be a leader, blah, 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 so on. That's all.
That's a great feedback. And I wrote down that app because I think that would be great. And we're aware of some research studies that are looking, and there's been talk for quite some years around some sort of standard around farms in Ontario. There's even grocery stores that had approached us as in OCOW, the Big Carrot in Toronto, which is an organic kind of company, was looking for some standards, whether something existed around standards for migrant workers in Ontario. So I think that side, and then the reporting app sounds like a great idea. And I think there's more experience with workers and cell phones. It's still very, I think it's still very limited. There a lot of people have smartphones, but in terms of navigation and kind of a lot of, but I think that there could be a lot of education. Like this summer, we're going to be really leveraging QR codes and education on QR codes to look at videos. So I think that sounds like a great,
John has said that there is already an app, a cell phone app that allows workers to assess and report called Hazard Assess. So it sounds like implementation of that is maybe your next step, but thank you so much. Migrant workers are near and dear to my heart, and it was a delight to hear from both of you on the work you're doing.
Thank you. Thanks, everybody. So just in the efforts of trying to stay on time, I'm going to ask to have everybody that's remained with us to open up your cameras, and we'll do maybe some last comments from our speakers today, and then we'll say farewell. But just before we get to speakers, I want to say thank you very much to everybody who attended today, to our speakers especially, who provided some very informative and very interesting information, some great recommendations, some great interventions and strategies in moving forward and trying to make our workplaces and others' workplaces more psychologically healthy and safe. So I will, let's see, we'll start with Enzo. Any closing comments, Enzo, before we go?
Just thanks for the opportunity to have the dialogue, and OCOW's tool is on the website. I saw the link there, so please hook onto that. If you want to have a discussion with me on that, by all means, reach out at my email address, and hopefully you'll share that here as well. Or just give me a call at ihca.ca or our website, and we can chat more about the survey if you're wishing to participate in it.
Excellent. Thanks so much, Enzo. And Kelly, any last wrap-up comment?
No, it was just really a pleasure to learn from all of my co-presenters, as well as the audience members who had some great questions, and I was speaking to on the side. And I wish you well.
Thank you. Thanks very much. And Eduardo and Leonor.
Yeah, I'm just going to say thank you so much for including us. And I think it's great to see examples of, workplace level interventions in this area. And that's really what we're hoping to push, in the area of agriculture to really get to that level, right? So we can actually be changing the conditions and factors at these workplaces. But yeah, thank you so much.
Thank you, Eduardo.
Thank you so much for sharing the experiences with other sectors. That's very interesting always to see how different things could be from one sector to the other one. There are not perfect worlds, right? But every sector and every workplace has their own challenges. Thank you.
Thank you, Leonor. Thank you. So do we have any comments or any last questions? I see a few people have come on. No hands. Okay. So I just want to take the opportunity. This wraps up our May Day for 2022. Thank you again, everybody, all participants across the world, across Ontario, all of our presenters also from across the world and across Ontario, across Canada. It's been a wonderful webinar session season this year. We are looking for next year to come back into an in-person hybrid maybe, but an in-person May Day. So we look forward to seeing you all again next year. And just quickly before we go, want to turn your attention over to, we do have a couple of more upcoming webinars next week. We have a heat stress webinar. I've just posted them up there for everybody. And we have our COVID webinars starting up again. So thank you, everybody. Have a wonderful day and stay safe and healthy. Bye-bye.
Thank you. Bye.
Bye.